Hello, I'm Cam. What's your name?
Well, let's do the Okay, he said the name of the person is Jawad Abu Bakr.
I'm sorry, what was that?
His name is Jawad.
Okay. How old is he?
So currently now, so currently now, he's 3.5 years old.
Okay. Um, what what are you in here for? What are your symptoms?
Very make it down sheet. Hmm. Okay, he's been having this fever for the past 2 weeks and cough.
Okay. How has the fever been? Has it been persistent or off and on?
Very in when I know for the for me, clear na zuwa ya je da wani. Mm-mm. Okay. Um, the fever has actually been on and off. It's usually worse in the evening hours.
Okay. Um, have there been any body aches? Any coldness?
Okay. Yeah, okay, QMGT. What QMGT? Okay, there are no body aches, but the child has a cough.
Um, has he what's been in the cough? Has there been any phlegm come up? Any mucus?
Well, then you're telling, okay, Magna one. Okay, yes, yes, the cough is chesty. It comes in paroxysm, and it occasionally associated with some mucus.
Has he had any diarrhea or constipation?
Yeah, okay, QMGT. So, yeah, okay, gudawa ko kuma baya bayan gari. Okay, there's no diarrhea or constipation.
Um, okay. Has he been cold in any ways? Have his eyes been showing any tint of yellow?
Sorry,
Um,
can you repeat that?
have his eyes been showing any like tint of yellow or have his fingers been cold?
Oh, okay. Well, akwai idan shi ya canja kala ya yi yellow ne ko kuma idan shi ya canja kala ya yi yellow ne? Ido, ido. Idan shi ya yi yellow ne? Wai ba don yi. In muka gama wannan. In muka gama wannan. Na ce ba, idan shi ya yi yellow ne? Okay, yeah, sometimes we used to have this yellowness of the eyes, his palms and soles are also noticed to be pale.
Has he been able to stand and walk?
Although yana tafiya, yana tafiya, yana tafiya, yes, he can stand anywhere.
Okay. Has he been feeling any fatigue that hasn't been helped by rest?
Okay, wai kamar ya fi son ya kwanta ya huta ko da yaushe ko kuma ya fi so ya kwanta ya huta ko da yaushe. Okay, okay. No, there isn't any much fatigue. The main symptoms are those the fever, is even having fatigue, and the cough. These are the basic things that we have.
Okay.
So do you want to ask them the nature of the environment where they live, if it's well ventilated, or if it's overcrowded, or if he has received any vaccines during childhood?
Wait, I'm sorry, what was that?
So do you want to ask them the nature of where they live, the nature of the environment where they live?
Yes.
Okay. Gidanku ɗakin da suke kwana akwai window nawa ne ɗakin da kuke kwana? Ɗakin da kuke kwana window nawa ne? Window ɗaya ne. Ku nawa kuke kwana a ciki? A ɗaki ɗaya. Eh, Akwai mai tari? Akwai mai tari a ciki? Okay. Okay. They actually live in a one bedroom apartment with about six of them that is poorly ventilated with only one window. However, there are no similar symptoms in his other siblings.
Okay.
Yeah. Would you like to go ahead and examine the patient?
Um, yes.
Okay.
I
Okay.
believe this is a lower respiratory infection.
Great. Great. That's exactly what we are thinking also.
There's one more.
Okay, that's exactly what we are thinking also.
Okay.
Yeah.
And typhoid fever?
Okay. We actually think that he has a lower respiratory tract infection. Okay.
Um,
So are there any investigations, any tests that you would like us to do for your patient?
I'm sorry, what was that?
Are there any tests that or investigations that you like to run for your patient?
A blood culture?
Great. So we actually took the samples for blood culture for your patient, but the results would be out in the next 72 hours.
Okay.
Yeah.
Um,
So would you like to recommend any treatment that we can start for your patient?
all right.
What treatments will you recommend for your patient? Would you like to give your patient some antibiotic?
Yes.
Great.
Ooh.
Uh, so would you also like to talk to your patient about some preventive measures against lower respiratory tract infections, particularly pneumonia?
Yes, I believe this is partially anemia.
Very cool. Great.
So, what was that?
I said, that's great. That's great. Yeah. So I'm going to translate exactly what you just said to your patient right now, okay?
Okay.
Wai ta ce tana tunanin kamar akwai ɗan ƙwayan cuta a cikin ƙirjin shi, akwai ƙwayan cuta a cikin ƙirjin shi, ko? Kina ji? Saboda haka za a ɗan ba shi magani, ko? Yeah. So, so she actually appreciates everything that you said about the patient, and I've also explained to her some of the preventive measures against lower respiratory tract infection, like making sure that the child receives all his childhood immunizations, and also that the child stays in a well ventilated environment and should avoid overcrowding. Okay, so yeah, so I don't know if there's any other thing else you like to add to your patient.
I don't believe so.
Okay, so you can. wave your patient goodbye and we can call it a day. Okay?
Okay,
Return and key.
bye.
Yeah. All right. So that's very wonderful. I really appreciate your your inquisitiveness. You had very directed questions and you were able to really get the diagnosis. So that's very impressive and you should be proud of yourself. Okay.
Okay, thank you.
You're welcome.